medications that you have to give come in a multi-dose vial, a single-dose vial, or sometimes they come in a single-dose ampule. Ampules are glass, as you can see, so they have to go in the sharps box, and you have to be very careful or you will cut yourself, or they can break very easily, because some medications are not stable in plastic. They have to be packaged in glass packaging. So these, this is actually it says a Lanoxin in a glass ampule. Now to use, when you're using an ampule, because when you snap that lid off, there's a chance that small pieces of glass particles can get in the medications. So if you're using one of these, you have to have a filter needle. So let's say that this is our syringe that we've decided to use. Let me get a smaller one. We've decided to use this one because I'm going to draw up 1 ml of this. So this says here that it is 500 micrograms or 0.5 milligrams per 2 mLs. So we need 0.125, or we'll say 250 micrograms. So we will draw up 1 ml of this. Now, unlike the multi-dose vials, I mean, you can keep this and use it later. Whatever's not used in one of these, you have to throw it away because there's no way to save it. So we're going to draw up 1 ml out of this. So I've got our needle, and usually syringes do not come with filter needles. You have to find a filter needle that is separate. It doesn't matter the gauge, it doesn't matter the length, because you're not going to give medication with a filter needle. The filter needle is just for you drawing it up, then you discard it and you put on a different needle to administer it, because you do not want to take the chance of putting glass particles into your patient. So I've done all my safety. Now to open it, you never want to open these with your bare hands because you can cut your fingers really bad. And you never snap them towards you. You always snap it away from you. And you never snap it in someone's face. You snap it away from everyone. And how you do it is, you use an alcohol pad. You don't want to use your bare fingers. I know some of my friends keep it closed and use a closed one, but I'm going to use an open one. So you wrap it around the neck. But first you have to you don't want the medication may be up in the neck or up in the lid of this. You can flick it and get the medicine down into the bottom of it. Or you can sling it and it will sling it all down. Okay? So you don't want medicine up into the lid. So I'm going to pop it away. And it will snap right at the neck. Now I'm going to throw this in my sharps right behind me, because those are very, very sharp. Now, so I've got my syringe, and this needle here is what I'm going to give it with, but I'm going to put my filter syringe on it, my filter needle on it to draw it up. I'm going to open it. I'm going to leave that one in my sterile package because I'm going to use it in a minute. And then this is my syringe I'm going to use. I cannot touch this with my finger because if I do, I contaminate it. So I'm going to use this. I'm going to open my filter needle. And usually this isn't a true filter needle. You would have, your facility normally has them, and they're usually a special color so they stand out. So I'm going to open my package. I'm going to be careful not to touch the end of that because I want it sterile. And I'm going to put my filter needle on my syringe. That's the safety device. I'm going to take my cap off, and I'm going to hold it and put my needle in, because you've got to hit it. Let me get it here. I have to steady my hand because I tend to shake. And I'm going to draw up 1 ml. Now you can turn these up and the medicine does not come out of them, but I'm a scaredy cat that way. And I'm going to draw up a little bit more than half, and I'm going to flick it out when I get it up. And I'm going to, oh, look at the air bubbles I got in there. And I'm going to give 1. And there's my 1 ml. Now, since this is my filter needle, I'm going to get rid of it. So I'm going to put my safety lock up on it, and I'm going to twist it off, Because again, you cannot give it with your filter needle because it may have little glass particles up in it. So I'm going to throw it in my sharps. Without touching the end of that, I'm going to put my sterile syringe on it. And that's how you put your other syringe on. Then you would go administer it. Now, if I was giving this IM, I would give it IM. But let's see what size needle this is. I didn't even look at the size needle. This is a 22 gauge 1 inch. Normally, if you were given true Lanoxin, it would probably be given IV push. In that case, when you're giving something IV push, all the IV systems now are made needleless. And we're fixing to go over IV tubing. But essentially, that just means you don't need a needle. That the screw part here would just screw into your IV tubing, and you would clean the hub, and then you would screw that into that area. But I wanted to show you how to change a needle. Then you would go ahead and give your injection. But again, you always use a filter needle when you're using this glass ampule. Whatever's left in it, because look, I've got another ml in there. That's got to go into the garbage or into your sharps because it's in glass. If that happened to be a narcotic or something that was controlled, you would have to get another nurse to witness that with you. And that's how you draw it from an ampule.